The most important thing is to raise awareness how important and precious this child life can be, and how this child health can impact their future health and the future of our nation. According to International Finance Corporation, more than 70% of the 43 million healthcare practitioners around the world are women. So having women in the field doesn't necessarily mean that they can involve in decision making or leadership position.
Hi everyone, welcome to Global Future Talks. This is Breaking Barriers podcast, and we aim to solve the future now. Back with me again, Cazadira F, Tamzil, and today, as always, I am honored to be joined by fascinating speakers, and today we have Dr. Jeslyn Tengkawan, physician and public health professional. Hi, Jeslyn.
Hi, Azira.
Thank you so much for being here. It is such an honor to welcome you.
Thank you for having me.
Yeah. So it's a funny story. I actually met Jeslyn last year virtually in a panel. And back then, I just felt like you had this really positive presence and aura, and you just had really great things to say about the Indonesian public health system, and also about your own profession. And it's very interesting to deep dive into all of that today, because in this first season of Breaking Barriers podcast, we aim to highlight the profiles of women leaders and also the great work that they do in their own professions, and how they help to break gender inequality as well through that.
Great.
So maybe to start off, you can share to us a little bit about your background, your journey, and how you got started in the public health space.
Okay, so I finished my medical school in 2017, and by then I have known that my passions is in public health, child health, and research. And so on my clinical years, I always imagined this, it should be ideal to have like children be immunized, all children be immunized, screened, and have high quality care. But in reality, it's not the case.
Yeah.
So not everyone can afford to have this high quality care and this 5-star care. Not everyone can afford to go to pediatrician or obstetric care. They can only go to posyandu, puskesmas, which is, of course, have improved a lot since decades ago, but it's still less than what we hope it should be. So I think I really want to see the affordable and accessible high quality care for all mothers and children in Indonesia especially, and that's how I found my passion here. And coming from this background of child health and maternal health inequity, I have to do something with all the knowledge that I have required for the last 5 years of my studies, which is not a short time. Yeah, that's how me and my friends initiated Capella Project Foundation, and we started with a vision to promote health equity for Indonesian children, so that every child is able to attain their optimal growth and development holistically and comprehensively. And this is very important because holistic means we're not only care about their biological body, like, as long as they don't have disease, that's okay. But we have to take care of their psychological, spiritual, social, and environment of how they live and how they grow. And comprehensive means we're not only treating, because we want them to be healthy, we don't want them to be sick, and that's why comprehensive is really important, because we are not only treating those who are sick, but we also want to promote health, to promote the importance of prevention and rehabilitative, and of course the advocacy, where it plays role not only in clinical settings, but we want to promote an equitable programs and policy. And that's why when we found Capella Project, the missions are not only to parents and children to get involved, but also healthcare professionals, policymakers, other non-governmental organizations, and of course the government itself. And that's how I found that's really important for me personally and for Indonesia, of course.
Yeah. So it's really interesting that you first, entered into this space because of your own personal interest in seeing more children and women and humans in general like get healthier lives, and be better. But then I think you also mentioned this when we first did that panel last year, that as doctors, it's important that you also engage in policy advocacy and not just treat sick people as they come, right?
Yeah.
You need to make bigger movements, bigger changes to prevent these people from getting sick at the very first place.
True.
You want to expand on that a little bit more?
Yeah, of course. I think this is obviously better explained when we look around about what happened on COVID-19.
Yeah.
We can treat people if we only like zoom in and we see how COVID-19 get cured. So we can focus on all the treatments and all what can we do for treating the disease. But when we zooming out, we found that it's more important to take preventive measures.
Yeah.
That's why the government make the policy to have all people do wearing masks and have all people keep distance at least 6 feet. And now we have to be immunized and vaccinated with COVID-19 vaccine. And it evolves. I think that's a very good example on how important it is not to see, to zooming out, to see how policy advocacy can really save millions of people at a time. Amazing, isn't it? It's not only, if I work at the hospital, usually I work one patient after one patient. It's also important because we have to be impactful for in individual lives as well. But if we're zooming out, it's also important because it can save a lot of lives effectively.
Yeah. So I think for what I understand, but you can tell me a little bit more about, because you're a public health practitioner, I understand that the government of Indonesia now is moving from a curative approach to health to a more preventive approach, right? So for example, on diseases affecting children like pneumonia, the government has committed to rolling out free vaccines nationwide by 2024 and things like that, right? So how is your response towards that, and what are you also doing, like for example through Capella Project or other things that you do to support that in getting more people to be engaged in preventive measures so that we can save millions of lives instead of just waiting to get sick, essentially?
Yeah, maybe first of all we have to agree on what our goals for our nation, right? We want our nation to flourish. We want to be a developed country, but it all starts from first 1,000 days of life.
Yes.
That's why we always promote the importance of taking care of children so they can grow and develop optimally. And one of them is by immunization and screening their growth and development continuously. And that's also why stunting become a big issue, because because we fully aware of human capital index, and stunting is one of the indicator. So I'm so happy that our government planning to roll out the rotavirus and pneumonia vaccines, because we know from Risk-Assess data that pneumonia and diarrhea are still the first cause of death among children, especially those under 5. And we call this years of life lost, and that's why it also creates a burden if people dies of pneumonia or diarrhea, and it of course different, so much different from developed countries where they're dealing with non-communicable diseases, while we are still struggling for combating these communicable diseases. So yeah, I think the most important thing is to raise awareness how important and precious this child life can be, and how does child health can impact their future health and the future of our nation. So we should not think only today, as long as the child's not sick, but we don't want them to only survive, but we want them to thrive.
Yeah.
And that's why it's important to raise awareness about how important it is to get your kids vaccinated. Like what we've been doing from Capella Project is promoting the importance of immunization, vaccination, why it's important, because people are less likely to do what they think it's not important. So we have to promote, and it cannot be done solely. So that's why multi-sectoral collaboration is very important.
Yeah. So before we dive deep into like multi-stakeholder partnerships, so just to clarify maybe to our audience that doesn't really know a lot in the public health space, that actually these vaccines are available in the private market, right? But what the government is planning to do now is to roll this out in the like national immunization program, so to make it free, accessible for all 100%,
Yes.
no matter their socioeconomic levels,
no matter
right?
of their background.
Yeah. So I'm also interested that you have had a lot of experiences serving communities in rural areas. And when we talk about inequality, obviously we need to talk about the rural versus urban divide, right? So how is that issue now in Indonesia? Like how bad is it, like the rural versus urban divide when it comes to access to healthcare?
Yeah, I know. It's frustrating. Yeah, I have to say it's frustrating because I will give a lot of examples because I think it's more practical and will give a lot of people more background and picture. So, for example, Capella Project just did, we called it Gili Child Health Day.
Gili Child Health Day.
Yeah, because we did like Child Health Day for children in Gili, Trawangan. So we know that Gili, Trawangan is a famous tourist island, and a lot of children live there, and it's so sad, and that's why we chose that place to screen children, to check their health, to promote health and raise awareness about the importance of child health. So what we found was a lot of children still, they don't get enough health care. They may be a posyandu, but it's not a regular one. A lot. So when I went there, I found that there's a puskesmas building, but no one's there.
Right.
Yeah. So it's just a simple example how child health disparities exist even in a populated or touristy island. I think it's
because of the lack of available healthcare personnel there.
Lack of healthcare personnel there, and they don't also have. I'm not sure. We have to, of course, see the root cause of this, but it's not easy to commute between islands, and that was Gili Trawangan. But Indonesia have thousands, thousands of islands, and I just can't imagine how sad the reality is.
Yeah. So I think I read the statistics the other day also that there is a very low healthcare facility to population ratio in Indonesia, and I think that's even among the lowest in Southeast Asia, right? So I think as a nation, we're also facing a shortage of healthcare personnel in terms of quantity, but also distribution of these healthcare personnel is also an issue, right? Because,
That's correct.
because maybe a lot of public health care professionals, they maybe just want to
Be in the big
in the big cities,
True.
right? So I really applaud people like you who are not afraid to go into these rural areas and actually provide healthcare services for those who are in need, especially when we know that the geographical situation in those islands are also not easy, right? Maybe you have to take boats or take motorcycles, right? Multiple times to go from one point to the other. So.
Yeah. I think I also want to appreciate the government's effort as well. They have been, like I said before, it has improved a lot. A lot more has been done, and we've gone this far. But obviously, we can do more.
Yeah. On the topic of doing more, you also mentioned this earlier, that there is a need to engage in more multi-stakeholder partnerships for us to improve the healthcare situation in Indonesia, right? Especially for children's health, which is like an area of your expertise and interest. So here at Pijar Foundation, we do believe in the importance of collaborative governance. So basically how public, private, and community actors can engage in meaningful coalition, how they can really share, exchange resources. The government can help from the policy side, the private sector can help from the innovation side, whereas the community obviously helps us to ensure that these policies and these innovations reach all the levels in society, right? So in your experience, have you come across an example of a powerful multi-stakeholder partnership in the healthcare sector, or maybe you have come across an area where you think there should be more multi-stakeholder partnerships?
Yeah. I can share what I found in my field of interest, which is child health. So I once attended a meeting coordinated by the Ministry of Education. It's on early childhood development, and most people attended the meeting were from educational background, and I think I can count with my fingers how many of them from the healthcare sectors, and from other sectors like healthcare, social works, child protection, etc. And apparently they all have made their own tools. For example, here we as healthcare professionals and maybe Indonesian Pediatric Society have already invented these tools to screen child development. But apparently education sectors also made a tool to screen child development, and not to mention the National Family Planning Coordinating Agency, or BKKB, and they also made another tool. And wait, I was saying, wait, we always saying that it's important to work together, but it's not, right? Yeah, it was, I think it was 2018 or 2019, but it wasn't
that long ago.
that long ago, and that should be, it's just a simple tool to screen child development, but imagine how far we can go if
we had just work together.
Work together and sit together and think which one is the most important one, and how can we agree on child development, and how to screen better, and how to engage better the community. And I think it's one of the eye opener that I experienced in life, how important multi-sectoral partnership is.
So you touched a very important point there, that actually healthcare is not just the purview of the Ministry of Health, but it actually is under the purview of many different ministries, different sectors.
True.
And we all have to really work together and sit and see, what kind of advances are needed in the healthcare space, so that we don't waste resources doing our own.
For example, you make a cake. I make a cake. We make for one person.
Yeah.
Would it be wonderful if we just make it together, like?
Or we can stack the cake,
Yeah.
as a two-tier
Yeah,
cake.
to make it a better one instead of just one, and it results. It's not impactful as it should be. And talking about multi-sectoral partnership, it reminds me of a whole of society approach, partnership building between government. So it's different from whole of government approach,
Right.
where it's only
The ministries.
Yeah. But whole of society means partnership between governments and all stakeholders of society, and it includes private sectors, civil society, community, academia, media, voluntary associations, families and individuals, in addressing not only health but also education, energy, agriculture, sports, transport, communication, and you can name all the sectors. Because when I learned about public health, I learned a lot about social determinants of health, where health is not affected only by healthcare, but it also affects by a lot of sectors like economy. How can you give your child a high quality food if you're not even employed? How can you give your child a high quality care or parenting if you're not educated, right? And that's why it's very important to work together and to clearly see that, we want to achieve the same goal. So what I found is a lot of people, a lot of sectors still have this egocentrism,
Right.
where they want to, I want to be acknowledged that I can achieve that. Like, they can do that. I can also do that.
Yeah.
But they don't want to work together just because this egocentrism. So we have to put down the ego and see what really matters.
Yeah. So, before we started this podcast, we had an interesting conversation about how you saw the videos that Pijar made about sustainability and energy transition and all that. And you also think that public health practitioners or public health professionals, they also need to be engaged in issues of sustainability that are, receiving global momentum at the moment. You want to talk a little bit about that? Like, why should people in the healthcare space care about sustainability, like energy or climate change? Or
This is a very interesting topic, and I just learned when I was in my master's degree, and it's just it's important because, like I said, it's like a domino where one sector can affect another. For example, climate change, it affects food security. It affects children's health directly as well. For example, in India, where the climate reaching more than 40 degrees, and a lot of children and a lot of, especially vulnerable populations such as elderly and children, got dehydrated and even die because of this climate change. And I think that's the important, that we should actively engage and advocate the importance of climate change and how it affects to health of the children, health of society, health of the community. And I think more importantly that, because, for example, before I learned about that, the importance of climate change, I was like, that's not my business.
It's not my business.
I'm a doctor. I'm a public health professional. I should only take care of people. Why should I take care of environment? That's, you have all people that take care of that issues, but apparently it's very important and it affects health as well. And
like waste also, right?
Waste as well,
which is like an important topic.
And smoking.
So COVID-19 is actually a great momentum in a way that it makes us more aware of health, the importance of health, and well-being, right? And it's I think a really great reminder for all of us to realize that actually there are still some gaps in our healthcare system that needs to be fixed through better multi-stakeholder partnerships and more multi-sectoral collaboration as well, right? But as you mentioned, I think there are a lot of forgotten diseases that even before COVID-19 have been forgotten, you know, and partly it's because maybe those diseases affect primarily the lower socioeconomic classes, so maybe they're not so much in the policy-making radar or the media radar, right? So I think it's a very important momentum for all of us now to realize how important health is and how we should make better changes, make better movements here.
I totally agree, because like what we see, COVID-19, like such a booming disease, and people put all their energy into that, and now since it's gradually subsides, we have to keep that fire burn and put that efforts into our fields of interest, whatever we're doing. So for example, do you know that climate change kills more people than COVID-19? And I think it's very important.
Yeah, and it's not to say that, you know, COVID-19 deaths are not important, but it's just saying that there are so many issues out there that deserve our attention as well, and energy, right? And we need to do more to fix. So at Pijar, we recently wrote an op-ed basically noting how COVID-19 has generated momentum for a really robust multi-stakeholder partnership, right? So that the fact that we can achieve 80% primary COVID-19 vaccination rate in a record time, I think it's amazing, and it's only due because of multi-stakeholder partnerships between the governments, you know, who make policies and obviously provide the free vaccines for all Indonesians. Also the, you know, private companies that have been rolling out these innovative vaccines, and also the community figures, right, who help to socialize and communicate the importance of vaccination to save lives from COVID-19, right? So Jeslyn graduated from Johns Hopkins, and I'm sure there you've met a lot of public health professionals from other countries, and I was wondering, like, if you have an example of, you know, multi-stakeholder partnerships or best practices in the healthcare system that you think can apply in the Indonesian context, or you know, maybe any lessons learned from other countries that you want to share to our audience today.
I want to acknowledge again for our government that have done a lot of things and have come so far, and I think we have to acknowledge first what we have. For example, National Health Insurance, BPJS. It's wow, like people, even my friends in United States learn a lot about BPJS and how wonderful it is. So we have to acknowledge, like, wow, we are doing great things, and obviously we have to do more, but we also have to see how far we've come, just to appreciate and to make us more
excited
about what we do and what the future can be, and really the sky's the limit. But I think it's important to see as well the importance of data, because right now with a lot of technology that we have, all the updated data we have so far is only COVID-19 disease, COVID vaccine. But do we have any updated data about how many children suffers from diarrhea last month? How many children who doesn't have quality food today or last week? And I think it's very important, because we want to make a program and policy based on data, not based on politics or based on political party needs or some people needs, but we want to see because a lot of issues going on, and we have to prioritize, and how to prioritize without having data. So I think it's the most important one.
Yeah. And maybe some of these forgotten diseases are forgotten because there are not a lot of updated data pertaining to those diseases, right? And if only we knew exactly how many children have been affected by pneumonia, how many children have been affected by diarrhea, as you mentioned, maybe there will be more urgency to actually act on those.
Yeah. I think I also want to highlight, like, diarrhea, it has been going on for hundreds of years, but why do we still have lots of those, right? There's something should be done, and we have to get to the root of causes, what causing pneumonia or diarrhea in this particular place, for example, or particular district. Is it because of the socioeconomic? Is it because of the environment that causing them to have this kind of disease? Because this is communicable diseases, and it highly affects not only by our behavior. It's different from non-communicable diseases, but it's also affected by how we do our lifestyle, right? Yeah, I think it's very important.
Right. So hopefully, like, COVID-19 is really a momentum for us to make more significant changes in our healthcare system.
Yes.
And we're happy to have people like you really in the field, and hopefully with Capella Project and other things that you're doing, you'll continue to make more breakthroughs in the healthcare system. So we started this podcast by asking about you and your journey, and now I want to kind of circle back into that and kind of highlighting or discussing a little bit about women in the healthcare space. And maybe you want to talk a little bit about your observation on how women is like in the healthcare system, and what is the situation there? What's going on?
Yeah, I'm so excited to talk about this because, you know, a lot of pediatricians are women.
Right.
How about nurses? How about midwives? According to International Finance Corporation, more than 70% of the 43 million healthcare practitioners around the world are women. So, yeah, it's actually populated with women, right? For this public health settings, for pediatric settings, child health settings. Even my peers, when I attend medical school and public health school, it's populated by women. It's important that women were strongly represented in the leadership of healthcare sectors. So having women in the field doesn't necessarily mean that they can involve in decision making or leadership position, and that's why, despite women's employment as doctors, nurses, pharmacists, or other healthcare professionals, available data consistently shows a lack of gender equality. And that's why we have to engage both men and women to reach the gender equality. And especially in healthcare sectors, inequality negatively impacts women's health. For example, exposure to risk and how health systems respond to women's needs. It's greatly affected by who is in charge of their leadership position. And especially we know that I talk about social determinants of health, and gender is also one of the social determinants of health.
Right.
We know in some countries, women are not allowed to obtain education. How can they take care of themselves if they don't have this proper education or health literacy? And I have to honestly say that it's been challenging for women in healthcare. For example, I read somewhere that the critical career building years between receiving a graduate degree and obtaining a leadership role are also women's reproductive years. And for men, having children is a career advantage. But for women, it is a career killer. And I can speak for my best friends who had the need to choose between career and family. And they are expected to excel in both, and it's just a lot of pressure. For example, just to get a medical degree, we have to spend at least 5 years.
Yeah.
And to get into specialty, for example, it takes 3 to 6 years. But at the same time, it's women's reproductive years,
Yeah.
right? Above 35 years, we are already in a high risk position
Right.
to give childbirth, I think, to get pregnant and childbirth. I think that's why it's so dilemmatic, and they also have this called baby penalty, where you can have either a job or a child. If you want both, be ready to sacrifice your physical and mental health.
So the challenges for women in the healthcare space is very interesting, because it's not that there's a low representation of women
True.
in the space, but there are two, like from what you explained. I think the first one is maybe not a lot of them actually get to decision-making level or
Yes.
managerial level.
True.
And partly maybe that's because of old biases against women and all that.
Yeah.
And also the second issue is how to make sure that these women healthcare professionals have the proper support that they need, so that they can maintain both their professional and personal life.
Yeah.
And what do you think the government can do, or the private sector can do, or the community can do to help provide women with more support in that particular area?
Yeah. First, I want to point out as well the disadvantage of women. We know that women are more prone, not only in healthcare settings, but in all settings as well, are more prone to harassment, to intimate partner violence. And that's why government or all agencies, all sectors have to really dive into this problem and protect women and protect children. And the solutions can be technical, for example, provide technical and leadership training, provide management skills, provide mentoring, and strengthen health education in resource-poor settings, because we know sometimes we have to go overseas to obtain specific education. For example, I took a pediatrics leadership program in the U.S. and it cost me a year, right?
Yeah.
And it's not an easy thing to do because we don't have similar leadership training in Indonesia. I think strengthening the education system, be aware that women's leadership training is also important, and accommodate parental leave and child rearing. I think it's also very important, because sometimes I feel my friends, especially those who are already have children and have to take care of their husband, it feels like they have to choose, because as the doctors are healthcare professionals, we feel the need to take care of other people, have to take care of children and families, but it's like we have to choose between our own families and other people's families, and sometimes it's very hard for them to balance both. We do a lot of night shifts, and sometimes my friends tell me about, Jeslyn, it's really hard. I have to pump my breast milk, but at the same time I have to take care of other people as well. And usually at night I can directly breastfeed my children, but now I'm in this emergency room, and I have my children at home, and I cannot do what's best for them. So it's very dilemmatic.
So I think you touched that the solution is not just like one program that we roll out and it's going to solve the whole issue. It's a whole of society approach where the government and the private sector and then the community, they need to work together to fundamentally eliminate biases against women, or discriminative practices against women.
True.
And we need to start also at home, I think, in breaking cultural barriers and thinking that women are weak, or women are, women are
supposed to be at
home and things like that, right?
Yeah.
So there are a lot of these biases that need to be kind of eliminated before we can actually see more women really thrive in the
True.
public healthcare space, or even other professional spaces as well.
Yeah. For example, right now we're only think about maternal leave, paid maternal leave, but it's also important for paid paternal leave.
Right.
So the husband can really support, and together can raise these kids to be the future of our nation.
Yeah.
Right. That's why it's very important for men, especially our listeners who are men, to know their roles in supporting women, because we can only go that far and we can reach the ideal, where the future world, only by having this man supports women actions.
Yeah. It's very, very important subject. And as you mentioned, healthcare is not just the business of healthcare people. Actually, there are a lot of issues that need to be resolved, like gender, climate change, sustainability, and economic issues and all of that, before we can truly see people achieving, or people realizing their right to healthcare. And health is a right? It's what everyone in the world deserves.
True.
And hopefully we can, see more changes going into the future as we shape minds, markets, and policies to be more supportive of women, to help resolve gender inequality, and also to help people achieve meaningful healthcare. Thank you so much, Jeslyn, Dr. Jeslyn. It's been a wonderful conversation with you, and we talked about a lot of things. So, and as I mentioned, when I first saw you, you always have a lot of these great things to say, and I'm excited to see what you're going to do in whatever it is that you do, and all the best for you and also for Capella Project.
Yeah, thank you so much, Cazadira and Pijar Foundation, for the opportunity. It's really great to share these important things.
Yeah, thank you so much, and let's hope for a better future for women and women in the healthcare space, and for everyone in the world in terms of their access to healthcare. Thank you so much, Dr. Jeslyn.
Thank you. Thanks for having me.
Thank you, everyone. This has been episode 4 of Breaking Barriers podcast as part of Global Future Talks. And hopefully you enjoyed this episode today, as we talked about health, gender, and many other things that actually affect health without us realizing it, like climate change and sustainability and poverty and other things. So thank you so much. Please stay tuned for season 1 of Breaking Barriers podcast. Let's solve the future now.